Now, second part of the sphenoid bone are the pterygoid processes. This is medial pterygoid process, which is narrow and short. This is lateral pterygoid process, which is broader and wide. Saida. Now, medial pterygoid process, if we follow it inferiorly, it ends in a hook-like structure called pterygoid humulus. Or if we follow it superiorly, it divides, forming scaphoid fossa. So you show this is scaphoid fossa. This one and this one. This is scaphoid fossa. More in between the medial and lateral pterygoid plates, this is called pterygoid fossa. So you show pterygoid fossa. No, this one is lateral pterygoid plate. Lateral pterygoid plate is wider. See that? Now lateral pterygoid plate, lateral to the lateral pterygoid plate, this is called greater wing of the sphenoid. Greater wing of the sphenoid, it passes laterally upward up to this point. So you show up to this point. So it not only form the base of the skull but also lateral part of the skull. Greater wing. See that? Now important features on the greater wing are, number first, it has got this oval foramen called foramen ovale. Posterior to foramen is called foramen spinosum. So you show foramen spinosum, posterior to foramen spinosum, this is hook-like structure. This is called spinous process. See that? Spinous process, not styloid. This is spinous process, and this is foramen spinosum. That's now more laterally it forms joint with petrous part of temporal bone. See that? Temporal bone. See that? That is a joint. More laterally it is continuous upward, which where it forms suture with squamous part of temporal and frontal bones. Now, at the end of medial pterygoid plate, here is a fossa or canal. We call it pterygoid canal, Pterygopalatine Canal. Sorry, Pterygopalatine Canal. See that? The Pterygopalatine Canal. It is then continuous with Pterygopalatine fossa. Pterygopalatine Canal. See that? Sorry, pterygoid canal. Pterygoid canal. See that? Now this is basic occiput, this is petrous part of temporal bone, and this is sphenoid bone. This structure which is formed in between these bones, this is called foramen lacerum. So you show the greater petrosal nerve pass ki branch of facial nerve. This was interior half of the middle part of base of occiput. So that was the posterior half. Posterior half, it is formed by base of occiput in the midline, or laterally placed petrous part of temporal bone. That should say that. Now a base of occiput has no other important feature except pharyngeal tubercle. Say that this one is pharyngeal tubercle, where a part of pharynx is attached. The pharyngeal tubercle. Now more laterally, this is petrous part of petromastoid part of temporal bone. Say that it has got this foramen called carotid canal. This is carotid canal. Posterior to carotid canal, this is called jugular foramen. This is jugular foramen. This is carotid canal. Structures. This one is called mandibular fossa, and this one is called articular tubercle. These two, this one and this one. So you show articular tubercle, mandibular fossa, carotid canal, in jugular foramen. That show this foramen lacerum. The foramen you show. So you show Nordic features. This one is external leucostic meatus. External leucostic meatus. This one is styloid process, which is not which is broken. So you show the broken. Then this one is stylomastoid foramen, through which facial nerve emerges. This one and this one, stylomastoid foramen. But that you can get posterior half of the middle part of middle part of base of occiput. Say that base of skull. Sorry. Most you can take a posterior part. Say the posterior part extends from the interior margin of foramen magnum to the superior nuchal line. So it is formed by squamous part of occipital bone and laterally mastoid part of temporal bone. So you show mastoid part of temporal bone. This is called mastoid process. So you show this is mastoid process. Medial to the mastoid process, this is called mastoid notch. Now mastoid notch show, a mastoid process show. The mastoid process او base of دا کوم چې دغه occipital bone دی lateral side صحیح ده دې دوه منځ کې چې دا کوم foramen دی دا stylomastoid foramen دی صحیح شو اوس چې کوم دا occipital bone دی it forms main part of posterior part of base of skull صحیح ده in the midline this is foramen magnum. Foramen magnum is lined interiorly by base of occipit and laterally by lateral parts of occipital bone and posteriorly by squamous part of occipital bone. Now these two introlateral projections, these are called occipital condyles. Posterolateral to occipital condyles, these are called condylar canals. This one is left condylar canal, right condylar canal, and this one is left condylar canal. See that? Now interior lateral to the interior medial to the occipital condyles, this structure is called this foramen is called hypoglossal canal. The hypoglossal canal show that through which hypoglossal nerve passes. See that? Now this is a notch in occipital bone and this is a notch in petrous part of temporal bone. Now these two notches they form irregular foramen called jugular foramen. See that? Now from the posterior border of foramen magnum, this crust is called external occipital crust. It terminates here on a prominent bony protuberance called external occipital protuberance. From external occipital protuberance, this line is called external superior nuchal line. So the midway between the posterior border of the foramen magnum and occipital protuberance, so external occipital protuberance, here is another line called inferior nuchal line. So you should. That's the structure of the base case.